Why does testosterone decrease in men with age?
Are you about to have a real insight right now?
Listen to me. I am a prophet.
I wrote this. Hoop.
Someone prescribes drugs.
Don't be so uptight.
Here's my advice. Dear friends, today, as I promised, we have a master of endocrinology with us. Today you can...
Both came, whichever you prefer. Yes.
Maître of endocrinology, Professor Svetlana Yurievna Kalnichenko. Besides the fact that a professor is sitting in front of me, this is not just a professor. Yes, this is a practicing doctor, the head of a major clinic, and the author of many best-selling books in urology and endocrinology. How many books in total? I think I've already lost count. Well,
already a lot. I've also lost track of them.
A huge stack. We
count the first ones, then stop.
So this is a person who teaches and explains how to do things correctly and properly. Even the Food and Drug Administration refers to your work. I think you know what the Food and Drug Administration is. That's about as high as it gets. You are an opinion leader, so I greet you with great respect. I live with you, so you won't let me lie. We are meeting for the second time. Let's go through the questions. Svetlana Yurievna, why does testosterone decrease in men as they age? Is this a natural course of things, or is it the effect of the environment, the conditions we live in, or stress?
No, well, first of all, it's not only men who experience this, the same thing happens to women as well. Testosterone, just like estrogen and progesterone, we don't divide them into male and female hormones. Testosterone is the main hormone for both men and women. And 45, that's it. 45 has come, youth is over. The most difficult transitional age begins from youth to 60 to old age, and during this transitional period, every day is a new encounter with yourself. Every day the secretion of testosterone, estrogens, and progesterone decreases, which means aging begins. But
it's always been like that, always.
Absolutely.
And why do we see signs of this aging more often now than our grandparents did? Or did we just not know about it before?
Times have changed and our grandparents know this, but now it's a completely different concept. We live in the 21st century, and in the 21st century, the concept of ageless, a person without age, has appeared.
Now biohacking is trendy, yes.
Biohacking, aging, I think it's normal that we know how to manage hormones.
Svetlana Yurievna, what is male menopause? What does it look like? With women, we know that a certain period comes, like 45, 50, 55. Their periods start to become irregular, and then the ovaries shut down and periods disappear. And what about men?
Well, with me, I also have great teachers behind me, right? Behind every person, behind every scholar who is someone, of course there are teachers. And my great teacher, Bruno Leonenfeld, well, a genius. By the way, he just turned 96. He still is, and not just for me. He has many students, he continues to be a teacher, meaning he generates new thoughts and ideas. Back in the day, he and I actually discussed male menopause, myth or reality. Does the term male menopause have the right to exist? No, it doesn't, because menopause comes from the Greek word meaning ladder or step. And for women, yes, they had menstruation, and then menstruation stopped. This is something you can measure. You can determine the day, hour, minute, second. For men, we suggested a term that is actually more accurate: age-related hypogonadism or late-onset hypogonadism, meaning age-related hypogonadism that starts later in life. There just isn't anything like that. Yes, there is a decrease in hormones just like in women, but men do not experience a complete cessation of secretion. That's why it's very important for men not to miss this moment. When it starts, many men blame it on the woman. They think it's the woman's fault, that she stopped attracting them, stopped taking care of herself, and so on. Our marriage turned into an incestuous relationship.
On the beach in Sochi, or on our beaches, or at some quarries in the summer, all the men at 55, 60 are pot-bellied, overweight, lazy. Many of them, not all, but many. And can you describe what a mom with hypogonadism looks like? That's my first question. And the second one is, what are the main 5 risks in old age due to diseases? If he does meet her with low testosterone and does nothing about it?
What is a man, a husband, and a rank? A husband? Testosterone is all about wanting. I can always see it in a man's eyes. When a patient comes in, I can tell if his testosterone is fine just by the way he looks at me. A man with adoration looks at all beautiful. Or, as he gets older, smart women.
You know, I said in one of the podcasts that I feel like a person has low testosterone. Sometimes I don't see it in the tests, and this statement of mine, that I can feel it and prescribe it, is often misunderstood.
The smell.
What diseases are men with low testosterone at risk for? Here are the main ones. For example, increased risk of cardiovascular diseases.
All of them. Let's open the International Classification of Diseases now and see how many diseases it lists.
So the risk of it happening?
Interesting. I never have. How many diseases are in the International Classification of Diseases?
A lot. And those numbers keep growing and growing. And
believe me, everything that's in the International Classification of Diseases. Well, except of course, for congenital ones. Yes, everything that's acquired in the International Classification of Diseases. Low testosterone will lead to this. For some people, low testosterone will reveal bad genetics. If someone has bad genetics for diabetes, they will get diabetes. If someone has bad genetics for cardiovascular diseases, they will get cardiovascular diseases. If someone has bad genetics for various cognitive diseases, like Alzheimer's, that will occur. Everything will lead somewhere. Testosterone is the main protective hormone. And by the way, I think you know this too, you recently defended your doctoral dissertation, right? And you know very well that if prostate cancer develops with good testosterone levels, it's a good prognostic sign. If it develops with low testosterone, it's a more aggressive cancer.
Yes, it becomes hormone insensitive faster. A small remark. Male prostate cancer, that is cancer of the prostate gland, before it develops, it occurs more often in those with low testosterone, but when it does develop, it uses testosterone as food. Many people say, I think you'll confirm this, you've probably heard it too, that testosterone causes cancer. Testosterone deficiency significantly raises cancer risk, while timely testosterone therapy lowers it. But if cancer is already present, only then, according to modern standards, testosterone is removed from the body. That's pharmacological castration. And indeed, yes, the type of cancer, its response to treatment, that is how it reacts to treatment, changes. And men who come to cancer with low testosterone, in principle, we can't really lower it much further. They have shorter lives, especially with metastases. Tumors progress faster on the Gleason scale, metastasize quicker, and reduce life expectancy.
If testosterone, and it's the same for women, testosterone is the main protective hormone, and in Russia, by the way, there is a testosterone medication that is indicated for metastatic breast cancer.
Many of our viewers, when they heard about women and testosterone, you know, they might have frowned. I liked your phrase because I say it too. There are no strictly male or female hormones. Men and women just have different hormone levels. We need female hormones, and women also need male hormones. And in our country, I rarely see women being given testosterone, but in many developed countries, including your clinic and others, there are good results.
Everything actually starts with this, because testosterone is the hormone, the king of hormones, the hormone of kings. Testosterone is the hormone of self-confidence. Women, just like men, need self-confidence. That's right, it's the hormone of fearlessness. Especially now, when we live in such an unstable world, which makes us, well, happy, stable, sovereign about tomorrow. That's right, it will never be needed again. The world is changing very quickly, so you need to protect your own. Testosterone.
Svetlana Yurievna, here's a question. A man with a belly, right? He could actually have a belly because his testosterone is normal, but there are some other reasons. Or after all, if his testosterone is low, is having a belly a good marker that even if your testosterone is within the reference range, but you have a huge belly, something might still be wrong with your testosterone?
Always. If even 1 gram of extra fat appears, just 1 gram, a man is already not living with his own testosterone. In the past, the people used to look at fat tissue as just a cosmetic issue, like, oh well, it's just a problem with appearance, obesity is just a cosmetic problem. Then it was discovered in the 1980s. How long ago was that? I don't even know if you were born yet or not. I feel like you weren't born yet.
1986, that's it?
When you were born, also, this hormone hadn't been studied much yet. Leptin, the hormone of fat tissue. And when leptin was discovered, people started talking about, fat tissue, fat. This isn't a cosmetic problem, it's a medical endocrine problem. And leptin deals with testosterone. Moreover, leptin not only lowers testosterone, it also reduces the production of the regulating hormone, luteinizing hormone in the pituitary gland. So it hits both here and there, it hits upward and downward. That's why it turns into such a vicious cycle. Excess fat appeared, testosterone dropped. Testosterone is a fat-burning hormone, so you need to get rid of this fat. He says, yes, you could go to the gym, run, jump, but no. Testosterone deficiency caused by obesity can no longer be treated with exercise. For a while, you need to apply, inject, or stimulate something. Everyone should have their own prescription for that. Editor, proofreader, A. Remove the fat, and then yes, testosterone will increase.
I call it the fat orbit, because he didn't do anything, he was lazy, didn't go to the gym, ate everything. He gained weight, his testosterone dropped, and now he's maintaining this vicious cycle. And I often prescribe testosterone replacement therapy well, temporarily, but I often hear, how can that be? Testosterone replacement therapy is for life. Can you debunk this myth that testosterone replacement therapy is only prescribed once and for life?
But look, you said it so well just now, being afraid. As soon as a person is afraid of something, I understand that he has low testosterone, because those who have good testosterone, they're not afraid of anything. Athletes, they have good testosterone, right? They have ambition. They want to have even more muscles, so they can be even stronger. They don't need replacement therapy. They're doing fine, but they use testosterone.
In some sports. Yes, that's right.
Athletes use it when they need to, and then when they don't need it, they stop using it. The same way.
Yes, for example, our dear beloved bodybuilders. He competes and injects, then stops both and remains on testosterone with a great sperm count.
Well, that's it. But this is a terrible myth. Testosterone causes infertility. Well, testosterone works the same way as contraceptive drugs do in women. Yes, of course, if you really overdose on it, there may be a deterioration of spermatogenesis. By the way, they wanted to come up with a contraceptive drug for men. It's the same testosterone. Well, you have to inject it more often than it's used for replacement therapy. But it didn't work on European men. It only worked on Chinese men who have a different receptor sensitivity. So, even if you try to use testosterone for contraceptive purposes, there's no guarantee that you'll get 100% contraception.
Regardless of the number of people on a cycle, some still show luteinizing hormone and follicle-stimulating hormone activity even without gonads. And they still have children, and healthy children at that. And interestingly, I've helped quite a lot of bodybuilders and athletes, not just in terms of sports, but also with recovery. Well, probably thousands. I'm not lying, I'm telling it like it is. In all my time, I haven't seen a single one. Well, maybe one. And even then, it's not a fact that it happened after the courses. No one knows what he had before, what was good before all this, and then it became nothing. I haven't seen a single person who couldn't recover anything. So these stories from people who, well, I don't mind when people talk about a healthy lifestyle, about good habits. But when they get too focused on the professional side, and they add a lot of myths there or are mistaken, well...
Who spreads these myths?
Those who benefit from it, those who want people to think that way.
No, I think that all the myths about hormone replacement therapy are, of course, created by our colleagues, who unfortunately don't understand this. Hormone replacement therapy is a complicated topic.
Many patients come with a cancer diagnosis, for example, kidney cancer or bladder cancer. He has androgen deficiency. It's not even prostate cancer, meaning it's not a hormone-active tumor. It's not induced. The doctor said, hormone replacement therapy. Who prescribed that? You can't even take vitamins. Absolutely not. Everyone go to the basement, sit quietly in the dark. Yes?
When cancer appears, give testosterone immediately to make it less frightening, since cancer is scary. And now, unfortunately, there will be a lot of this.
But who actually needs hormone replacement therapy? Surely there are people who can do without it. Guys, come to see me. I don't prescribe it to everyone. If I see he's barely sleeping and going through a divorce, I will. There are also other factors that, if removed, for example, I say he's a triathlete who just can't handle it. He's not hypogonadal, he simply can't manage the load he's put on himself. I call these social indications for testosterone replacement therapy, but he can't stop training for competitions or speed up his divorce right now.
Of course, he's under stress. I mean, it's stress related. So you always need to figure out the cause of hypogonadism. There's the age factor. 45 and older, as we mentioned, is considered age-related. Right. Someone might, by the way, slip through, from 45 to 60 without us. Who will slip through without us? Men with a strong sexual constitution, with a short, sensitive androgen receptor. Yes, it's the same for them. Everyday secretion decreases, but their receptor is so sensitive that even this lower level is still enough for them. Yes, but at 60 they'll still come. But unfortunately, they'll already come with some with complications. They'll come with something already like osteoporosis somewhere or sarcopenia somewhere, losing their muscles. Well, it just doesn't happen without us. This period, it never passes without some more or less significant damage to the body. That's why we tell everyone that 21st century medicine should be, what should it be? It should be preventive. Preventive. There are diagnoses that are embarrassing to make in the 21st century. For me, the most embarrassing diagnosis is obesity. Well, it's embarrassing. So, if a man is lean and fit with abs at 45, he should stay that way at 60 and 75 too, right?
Many retirees in other countries do. Germans and Italians look very different on vacation. The government offers hormone replacement therapy programs. On time.
They detect it on time. Well, it's culture, It's culture. In Russia, unfortunately, Russia is still a militant country. Hormone phobia. Here, they're even afraid of vitamin D, let alone testosterone. 10 years ago, we were talking about a pandemic of vitamin D deficiency. We need to start doing something. You can't even imagine how much they fought against us.
Yes, even now. Svetlana Yurievna, I prescribe it either here or on YouTube. You said you watched the vitamin D episode and suggested taking 5,000 units at once. Are you following those recommendations? Here at the Ministry of Health?
Horse-sized
dosages, horse-sized 600. He's been taking these 600 for half a year now to a dead can.
Again, who is doing this? You see, it's being done again by those who benefit from it, secondary gain, not to treat. Because everything actually starts with vitamin D. If vitamin D is even slightly out of range, we will never be able to cure it. That very obesity, the continuation, which will develop against the background, let's say, of hypogonadism. Because vitamin D is just as powerful a fat-burning hormone as testosterone. So you can inject yourself, that's it, smear yourself with testosterone. But if there is a vitamin D deficiency, the obesity won't go away, and libido will be there, of course. There you go. You can hear and see it everywhere, but the obesity will remain.
Svetlana Yurievna, I have a question regarding antiestrogens. Well, we call them antiestrogens, but that includes inhibitors and everything else in the same group. So, when a person has hypogonadism and they are treated with antiestrogens, well, not treated, but given therapy, because when you stop them, everything drops. Luteinizing hormone and follicle-stimulating hormone drop. But here's the question. I'll share my view of the problem, but I really want your opinion too. First of all, I see a problem when it's prescribed with high luteinizing hormone and follicle-stimulating hormone. That is, for those whom it definitely won't help, it will only do harm. Even with normal luteinizing hormone and follicle-stimulating hormone in principle, I don't really support it, maybe only if they're low. And even then, I'm not a fan. Check or test it for a month or so, but I don't understand people. I'm wary of those who prescribe anti-estrogens long-term as an alternative to hormone replacement therapy. They claim hormone replacement therapy is poison and a nightmare, but the testicles can still work, right? There are a lot of excuses, but I was just writing an article with Yevgeny, by the way. We didn't find any study that checked over 10, 15 years. There's almost no information on how anti-estrogens affect the male body. To me, that's like asking if you've been smoking for 5 years or 2 years. All my friends are fine, and cancer is a myth. You can't get cancer from smoking. You probably know about Operation Mindspot, since you're also in neurology. When they removed the bladder in children, it had to be replaced with something. And they came up with this Operation Mindspot 1 and Mindspot 2. And Mindspot 2 is when they transplant the ureters into the sigmoid colon. And it would seem that the child walks around without a stoma just fine. There's no bag. And he just goes to the bathroom for both number 1 and number 2 at the same time, meaning everything leaves through the rectum. A great outcome. For 5 years after this operation began, it was all they did and recommended to everyone. After 15 years, everyone developed cancer in that section of the intestine, in the sigmoid, because urine was getting in there. That's why 10-15-year results matter. What's your view on anti-estrogens for therapy?
I am fighting against this absolutely incorrect idea. Continuation, ignorance, subscribe. Subscribe. 5-alpha reductase and aromatase converted either into dihydrotestosterone, that very active hormone that does everything, or influenced by aromatase, 5 estrogens. And in general, here is evolution. And the pinnacle of all endocrinology is, of course, estrogens. Here is I. Estrogens are the main hormones both in the female and male body. They are the main hormones for cognitive health, the main hormones for cardiovascular health, and the main hormones for immune health. And in general, everything we do in our clinic, we do it all for the sake of estrogens, because estrogens are responsible for production. And for you, as a urologist, everything will become very clear to you now. You're about to understand. Actually, it's just such an insight. Estrogens, not testosterone, are responsible for the production of nitric oxide.
Endocrinology isn't painful. You don't feel endocrine diseases immediately. And if you don't look 10 or 15 years ahead, well, at the very least, that's foolish and it's irresponsible toward yourself. And you know what bothers me? I'm completely sure, here you are, an expert telling us all this. I understand smart and well-read people get it, but there are guys out there, impressionable ones, whose blogger friends, their gym buddies, will be telling them things. That's nonsense. I don't see why people have this attitude toward endocrinology. You wouldn't let your friend fly a plane because he's not a pilot. You wouldn't let a friend pull your tooth or fit a crown since they're not a dentist. But endocrinologists, half the country are endocrinologists here. Every fitness trainer, every fitness blogger is an endocrinologist. And there, yeah, I've treated 500 people there. All are fine and everything's great. Why can't they read a pilot? That's on them. But why, guys? My audience is smart and well-read. I see how much they appreciate what you provide. Why is there so much ignorance when the information is obvious? They take things out of context. There are 300 articles out there, some even claiming omega-3 vitamin D or sleep are harmful. Contradictions exist on any topic, and they manipulate by taking hundreds of articles out of context. He might pick just a few to misrepresent them. And he says, look, I'm not saying what everyone else is saying. Listen to me, I'm a prophet. Well,
yes, that's just how things are now. What times are we living in? How can you quickly make a name for yourself there? Well, by what? By disproving something. Omega is bad, D is bad, and testosterone is bad there.
Water is bad.
Water is bad. Yes, that's it. That's how it is.
You know, Slava,
Power, money.
as they say, when you can't move science forward or back, you have to push it sideways. This is about those GSPG guys. This question has already become so tiresome. A few questions. First, for some reason, everyone insists that there's a referendum. 18 and the numbers vary. Sometimes it's 50, sometimes 60, 70. And that at 18, if you have 70, that's okay. Is there a correlation with age? People often take it out of context when we say equal to age for convenience, but there is a correlation. So after puberty, it reaches a certain level and is roughly comparable to our age. It's nearby, then at 45, 50, and 60 it spikes. For some it rises at 60 or 70. Even with the same testosterone levels, we no longer feel it. So where's the logic? If at 18 you have sex hormone binding globulin, there's a study linking it to age, and it's 70, why do people say it's within the reference range, everything's fine, no testosterone deficiency? First, what is sex hormone binding globulin, and why does it impact testosterone so significantly for many people?
I follow your fights.
For
Your fights that are happening now on
YouTube's Expanse about GSPG, I haven't watched any videos. They said someone filmed something, but I swear on my mother's health and to the whole country, I haven't seen any and won't watch them.
your opponents say, where is it written? Where is it written that GSPG? It's not written anywhere. They made it up. Well, let me tell you where it's written. It's written. I wrote it. This is written in our amazing document. I'll give it to you. I'll send it to you electronically. You'll have both a printed and an electronic version, and you can share it. This is written in our amazing brochure. It's a printed brochure, and you can refer to it. Age-related hypogonadism. What about sex hormone binding globulin in men as they age, meaning after 45? But what is the brochure about? The biological age should match the passport age, right? Yes, that's true. Sex hormone binding globulin. So what is it? Up to there? Let's say 45. We're not too concerned about it, but it's very important that after 45, when aging begins, sex hormone binding globulin should match the passport age. Sex hormone binding globulin, the protein that transports sex hormones. In English, it's called sex hormone binding globulin. It carries testosterone, estrogens, and progesterone, but it has a higher affinity for testosterone. So it's like a trap protein for testosterone. That's why when its levels increase, the more of it there is, the less free testosterone there is. A lot of research has been dedicated to this. So we didn't come up with this, we noticed it. We noticed it because, of course, we have a tremendous amount of experience. So the number of sex hormone binding globulin tests we've processed through SYA is enormous. And we noticed this correlation and started giving different examples. There are methods to lower sex hormone binding globulin. The most effective is testosterone. Nothing lowers sex hormone binding globulin like testosterone. In second place is growth hormone. By the way, there are more and more studies coming out now that talk about when sex hormone binding globulin increases. When aging begins, it's a marker of aging. But what actually triggers aging? One of the interesting new concepts, and I think I agree with it, is that aging is triggered by a decrease in growth hormone secretion. So, aging at 45 is not really aging yet. 45 is more like preparation for aging. Actual aging starts at 60 with the decrease in growth hormone. That's why the men who have been with us for many years and who started at 45, that's ideal. At 50, it's also not bad. At 55, well, it's not as good, of course, but still, okay. They started hormone replacement therapy, either with testosterone medications or with chronic gonadotropin. The effect starts to wear off for them at 60, and at 60 we add growth hormone for them.
Svetlana Yurievna, together with Yevgeny Alexandrovich, Andrei Yurievich, Professor Pavlov, and Dr. Tyuzikov, we co-authored an article where everything you're mentioning now isn't just our opinion. It's all backed up with references, really. You mentioned a correlation with age based on large studies involving hundreds of thousands of patients, all with supporting references. And interestingly, there are a lot of references showing that sex hormone binding globulin not only transports, but also modulates testosterone. That means its sensitivity and metabolism change, including dihydrotestosterone. The main issue with those saying it's just a transporter is that higher testosterone should mean more transporters. But the main problem is that exactly...
The opposite is true. Yes, it's exactly the opposite. That
besides being a carrier, he is also a modulator, meaning he influences how it works and acts. And do you know what question I have about sex hormone binding globulin? Sometimes guys come in and they have very high sex hormone binding globulin and they feel great. They're lean, possibly due to efficient dihydrotestosterone conversion, as only a small amount of testosterone is converted. Athletes often have high sex hormone binding globulin and play sports. Some believe it must be lowered, while others say it shouldn't be lowered. Well, I'm still a supporter. Maybe I'm wrong. I don't know. You can correct me. What? If there are clinical signs of hypogonadism, potency, erection, all the questionnaires indicate it. If there are signs his sex hormone binding globulin is high, it means something. I do therapy. If not, I don't care that it's high. But again, it's taken out of context. They say just to lower it. Yeah, it's not just about lowering it, but I will never try to lower sex hormone binding globulin just because it's high. If the person is healthy, of course, you shouldn't.
treat the test results. Well, that's just treating the numbers. We're treating the person, not just some clinical indicators, right? We've just started. It's amazing. We do genetics for everyone. That's personalized, not just a passport. We do it for absolutely everyone we examine. We look at the sensitivity of receptors to sex hormones.
The number of repeats.
If it's an androgen receptor, it's about the number of repeats. There, zack. We look at the sensitivity of receptors to testosterone, to estrogens, to progesterone, to vitamin D, since that's also a steroid hormone, and the activity of enzymes involved in metabolism, the activity of aromatase, and the activity of 5-alpha reductase. And also, in this same analysis, we look at genetic factors. That is, some people genetically synthesize more sex hormone binding globulin while others synthesize less, and this is also included in this analysis. That is, people who simply genetically synthesize more sex hormone binding globulin and...
Well, that's why they're distant, that's why they might look good, but that doesn't give them the right to say that high sex hormone binding globulin is okay.
Of course, so what else? What's interesting about genetics? So someone might have a lot of genetically determined sex hormone binding globulin, but they have a short receptor, they have good sensitivity to testosterone, and not just a short receptor, but also increased 5-alpha reductase activity. That's why their testosterone will convert to dihydrotestosterone more than to estrogens. But by the way, that's actually bad. So this is actually a bad genetic prognostic sign in such men. They are in the risk group for prostate cancer, and they are in the risk group for prostate hyperplasia. Well, you can spot them. Editor, these are the men with that very alla pizza.
Wolf-like ears appear.
Yes, the back of the head. Going further is another topic.
This happens in those who have reduced sensitivity to progesterone because progesterone is a natural blocker of 5-alpha reductase. So, high sex hormone binding globulin can be a cause of androgen deficiency.
Of course.
We are wrapping up this issue.
Of course. And once again, of course.
Can high sex hormone binding globulin be normal for some athletes and sportsmen?
Well, if they have genetically increased sex hormone binding globulin secretion.
We don't treat high sex hormone binding globulin itself, only clinical symptoms, if present.
Yes, so...
We don't just lower it for everyone. It's exactly like looking in a mirror. And...
Low sex hormone binding globulin, if present again and not genetic, is significant.
An indicator or sign of something, for example.
Low sex hormone binding globulin is the issue. It's a marker, usually of elevated insulino.
Resistance. Insulin also lowers it, similar to growth hormone. By the way, Andrei Yuryevich Pavlov suggested the work on benign and malignant urinary tract lesions. In our center, a topic in this direction is already being approved. We want to show not just from personal experience, but to demonstrate that a really high sex hormone binding globulin disproportionate to age, when it's high, like 40, 50, 70, 80, these people are more likely to develop adenoma and they have more predispositions to oncology. Maybe. Right now we want to approve this topic.
Of course, because high sex hormone binding globulin, low testosterone, high insulin, that's it. Low testosterone is always insulin resistance, and all oncology is insulin resistance. Insulin is a hormone with mitogenic activity. That's why I would tell everyone, be afraid of low testosterone. Don't be afraid of high testosterone, because low testosterone will definitely lead to oncology sooner or later.
I can confirm that the majority of patients in both my oncology department and oncogynecology department are overweight patients. And officially, in all the guidelines, the group and risk factors are overweight people. Well, aside from smoking, which is obvious, it's overweight people. That's kidney cancer, bladder cancer, and prostate cancer.
We need to stop calling these overweight people just overweight. We should call them people with obesity. Testosterone deficiency in metabolic syndrome is hypogonadism. Yes, hypo. After all, everyone is so afraid of this diagnosis, but there's nothing scary about it. Hypo means decrease. Gonadism is just stating the fact that for some reason the testicles or ovaries in women aren't producing enough testosterone.
Tell me, in what situation does a young man come in? And what is the most common reason? Are we there? Who are the followers of this theory? I use different methods, and I don't dismiss the method where sex hormone binding globulin is lowered with testosterone. Yes, it does decrease, and yes, I also use that as one of the approaches. They ask, how is that possible? A 25 or 30-year-old man has high sex hormone binding globulin and high testosterone. Would you still start him on testosterone replacement therapy? What do you think about prescribing testosterone therapy to a young man if he has very high sex hormone binding globulin?
I don't understand what we're afraid of.
I'm not afraid, and
But what are those who are afraid to prescribe testosterone afraid of? What is it?
are they afraid of? Well, they want to stick to what they know. I explained this is among the mildest forms of hormone replacement therapy, like diabetes treatment. When your pancreas doesn't work well, you're forced to use insulin, and you don't just have to use it. It's not as simple as getting a weekly or bi-monthly injection like Nebido. You must track your food intake, adjust to your sugar levels, frequently change doses, measure them, prick your finger, or use a sensor. Compared to people with diabetes, it's almost laughable. That's why everything is understood by comparison. With diabetes, it's rarely just about having the disease. And they say, this is made up, there's no diabetes, it's all just in your head. We'll give you some herbs, you'll start exercising, take contrast showers, and everything will go away. Why is hypogonadism viewed so negatively?
That's because hypogonadism is fear. A person starts to be afraid of everything, that's all.
That means he will resist until the very end. You have to wear him down for him to come to this.
Also, I just thought of something. Maybe in the wider world, people think that hypogonadism means impotence. And probably they're afraid that since I have low testosterone, it means I'm impotent. What is a man most afraid of? So let's dispel this myth that low testosterone doesn't mean the same thing. Impotence, right?
I have a question right away.
Yes, of course, there will be a slight decrease in libido, but a slight decrease in libido or even a significant decrease in libido does not equal impotence, right?
May I? Here's another interesting question. A young man comes in, 25 years old, high testosterone, high sex hormone, binding globulin, good erections, libido is fine, not overweight, but he has depression, apathy, and gets up at night to go to the bathroom. Complete the abnormal involuntary movement scale questionnaire. All his scores approach 5 points. He seems to have what we often associate with it. I made a YouTube video about the science of testosterone deficiency. He says, well, you listed all the diseases. I didn't list all of them. I just explained what kinds of masks there are and how it manifests. It's not only about the penis or libido. There are many other symptoms, and everyone experiences them differently. If his potency and libido are fine, it's hardest to convince him he needs testosterone. They're usually referred to a psychologist, psychiatrist, sleep specialist, or even a nutritionist. And how do you feel about people like that who have a good erection and good potency? They have high testosterone and sex hormone binding, globulin, testosterone is prescribed. Because he has some kind of cognitive dissonance in his body with sleep, problems with motivation, problems. Does he need a psychologist or endocrinologist? No.
Well, testosterone is the main antidepressant. But who will have depression, who will have obesity, who will have erectile dysfunction, it's all very individual. We started by saying that all diseases in the International Classification of Diseases, except for congenital ones, right? So low testosterone will lead to all these diseases.
Svetlana Yurievna, I have a bit of criticism for all doctors. I don't know how it is in your clinic, but I do have some criticism. Yes, someone with hypogonadism comes in, that's it. Then there's testosterone, and that's all. But what about the regimen? It's just not mentioned. It's natural that you need to exercise, eat properly, try to sleep well, stop abusing alcohol, and quit smoking. No.
Well, that's all clear, but people don't come to us for that.
We should probably say that, right? Of course. And why do doctors often just give you a vial of testosterone and that's it, but don't have enough time? Or is it just hard? I understand someone arrives after living in their own bubble for 20 years.
Well, I really don't know. It's just 12 minutes, right? Well,
Dad, yeah, that's it.
what can you do in 12 minutes? That's what I mean, 12.
You must write everything within these 12-15 minutes.
Well, that's why I think doctors simply don't have enough time for this.
The question is about testosterone levels. As shown in some measurement scales, there are established norms for testosterone. Well, 6 nanomoles, 8 nanomoles, 9 sometimes 12, and sometimes there's a note saying we recommend 12 or more, so...
If you read this note carefully, you'll see what it says. It is recommended by the International Society for the Study of the Aging Male. This society was actually founded by my brilliant teacher, Bruno Lunenfeld. I am the president of the Russian branch of this society. And this was many years ago, when there was only one laboratory at that time.
Let's not mention it.
Right, let's not mention it. They wrote 519, then comes the lower limit, 5, and the upper one was, I don't remember, they had something like 20 something. But back then, they honestly wrote the reference values.
So it could be from...
They didn't write normal. So what's the issue with lab diagnostics? No one knows what's normal. Only experts who deal with a specific issue know what's normal, while the lab just writes the reference values. What is a reference? It's an average, like...
penis length. So...
They took 100 conditionally healthy men, measured their testosterone, but the man doesn't know. Who knows the definition of a healthy man? Do you know who you can say, he's healthy, he's not healthy?
You know, sometimes I call men who behave like women, I call them standing peers, Why do you act like that? You have barely any masculinity. Aren't you ashamed? Well, when I try to explain, I tell you, the ability to pee standing up doesn't make you a man. Yes.
I agree, that's a social man. So that's how we evaluate whether behavior is masculine or not, but how do we measure it with you?
It's a combination of everything. How he behaves, how he feels, what his lab tests show, what his questionnaires say. A lot of things, but...
Everything begins. We created a definition. We are health, both male and female. We have been working towards this for a long time. When we opened the clinic there 12 years ago, it was all very different. 12 years ago, there was a very negative attitude toward commercial medicine. It was considered, not entirely honest. So when we were opening the clinic, I said it has to be the best clinic. This will be the best clinic on earth. And the goal is not just to treat, but to cure. and we needed to understand what does it mean to cure. And we came up with the formula for a healthy man, healthy 2 plus, 2 minus. What should a healthy man have? Of course, what is men's health really about? How is it different from women's health? Men's health is about erection, of course. That's why a healthy man should want to and be able to satisfy his woman properly. So, sex, what else should a healthy man have? So, a healthy man has the desire and the ability, and a healthy man should not have obesity. A healthy man should not have to get up at night to go to the bathroom, meaning he should have normal sleep, sex, no obesity, and no nighttime awakenings.
12. You know what's confusing? There's an expert sitting in front of me who basically just crossed his arms. You yourself refer to the fact that the number should be 12, and when we tell you...
Now we're already saying 15.
Yes, 15. Honestly, I'm even saying more. A bit embarrassed because we're saying 15, but it's all individual. There are people for whom we'll say everything is fine, even at 14. That's everything we've mentioned. Sensitivity, genetic features. Some people do well with a level of 20 and normal sex hormone binding globulin, but it's still insufficient for others. So what is your opinion on making clinical decisions based on symptoms, complaints, and what we observe? Even though the value falls within the reference range, we still make the diagnosis of androgen deficiency. I do this as well.
Look, we've actually moved even further, and I encourage everyone to join this revolution, to stop looking. Testosterone, estrogens, progesterone, vitamin D, to stop looking at all steroid hormones.
By blood, well,
of course,
saliva.
Of course, and then the battles over sex hormone binding globulin will be over, because it only gets into the saliva.
Numbers?
Yes, hormones get in without carrier proteins. So basically, saliva is us, you and me. It's like, it's like a cell biopsy. We got inside the cell and looked at what's happening there. And we've been working with saliva for a long time. We were developing those very same ones, still not the norms. That is, we only know some reference values for now. And as we gain more experience, we change something here and there. And so we gave up. In saliva, here is the upper limit of testosterone. That is a certain lower... Look, but there is no upper limit. It's different for everyone. Saliva is unique. In general, testosterone, of course, I'm telling you, it's just a unique hormone. And so if we look at the blood, well, the higher it is, of course, the better. There is no upper limit. And then there's sex hormone binding globulin, which increases with age. And if we measure it in the blood, that very total testosterone increases. And we end up in a diagnostic trap.
The test is high, but not functional due to sex hormone binding globulin. Yes, I use saliva myself. I recommend it too. And really, it's more informative in situations when we have high sex hormone binding globulin.
What's interesting about saliva, you can't separate testosterone from those very estrogens. And so those who are fighting with estrogens, thinking that this is it. All the bad things in men are not from a lack of testosterone, but from an excess of estrogens. How did they come to this misconception? Because they look at estrogen levels in the blood, and in the blood, testosterone is elevated by about 1.5 times, but estrogen is elevated by 10 times. So when we look at estrogen in the blood, we need to divide it by 10.
There are guys, unfortunately, even with a medical education, who say that well-known doctors... Zhenya told me that someone said somewhere, also in some videos, I think, that testosterone levels are normal, and the only reason why testosterone is prescribed is because they want to sell it. For example, I don't prescribe it to sell or promote testosterone or the clinic. I haven't done so in the last 5 years. I don't have a prescription book. I make recommendations, but I haven't written a single prescription in 5 years. If anyone brings me and shows me a prescription with my handwriting that says testosterone and has my stamp on it, I'll give them $1 million. Well, I don't have $1 million right now, but I'm so sure that I'm ready to give it to if someone brings it. And that's why, for example, when he says something about you too, they tell me that I prescribe things. I haven't prescribed anything to anyone in the last 5 years. At most, I just recommend it, that's all. Secondly, I don't have my own clinic. I perform surgeries at a private clinic and treat oncology at a public hospital. It's wild that people are being misled and told others are profiting from this. That's why I made this podcast, to help get as many people as possible out of this pit of lies. So that people who, I'm sure, they're honestly mistaken. I mean, they don't know, they know the truth. They sincerely believe what they think, and they speak the truth, that what they say is really how it is. But I think that in 3 to 5 years, they'll be ashamed when their minds finally get to the point where the deduction is partially...
I doubt it. I really doubt it. It will be.
It will be Svetlana Ilinichna. Many
Are deliberately digging these pits. They are digging pits of lies.
And what would you say to people who claim that testosterone was prescribed even when their testosterone levels were high or normal? It's all because of money. How would you respond to such statements aside from filing a lawsuit?
Just on a human level. Well, first of all, a person came in with normal testosterone levels and testosterone was prescribed. Believe me, this is what we teach everyone. So, colleagues, if any of you are listening, please come and learn. Every last week of the month we have our courses. You need to spend a week with us to understand that no one comes until their testosterone is normal. No man and no woman will go to any doctors. So, as soon as the door to any doctor's office opens, the person already has low testosterone, obesity, and exhaustion. Why do men go? We just talked about the formula for health. Normal sleep, normal sex. 2 pluses. Obesity is a minus. Getting up at night to go to the bathroom is a minus. So we went further. Now we understand the formula for health. It has become simpler. It's muscle mass and strength. That's all. And we came up with an amazing, amazing. Not everyone has a dynamometer. I also didn't understand why. And in this cycle, I bring a dynamometer and repeat, here, girls should squeeze 31 boys, 45. Look here, it's very interesting. The cycle is ending. At best, 1 or 2 doctors. They buy themselves this amazing tool. I couldn't understand. I thought, why are they paying money? When? How are they going to do all this? They can't do it themselves. If he can't do it himself, of course, he won't use it.
Sometimes I come to the intensive care unit during rounds when there are critical patients lying there, and sometimes it's hard for me to understand whether he's regained consciousness or not. I hold out 2 fingers and say, squeeze as hard as you can. The old man squeezes so hard my fingers nearly crack. I understand that. Let's
shake each other's hands. You can do it there.
Oh, firmly. There you go.
Yes, here's the test. And that's why for those who... There are no dynamometers we came up with. It's also very simple. Right now, everyone who's listening to us can find out whether their testosterone is okay or not. The Smykalov Index. As they say, we don't age by years. We age, this is about sports. We age with our legs. And the first clinical, truly significant and serious manifestation of testosterone deficiency is a decrease in volume, the calf, and here is the Smykalov Index, which means a healthy body is 2 calf circumferences. The continuation should be greater than the circumference of the shin. That's why the increase starts here. This is a sign of testosterone deficiency, or the decrease starts here. That's why there are thin people on the outside. Now, there are a lot of thin fat people.
It's called skinny fat.
On the outside, it looks like a perfect body, but behind that perfect body, there are very few muscles.
Sarcopenia.
Yes, those thin little legs, but there's still fat there.
Many people, when they hear sarcopenia, think it means there are few muscles. They think we're only talking about the muscles that are part of the skeletal musculature, but we're also talking about the heart. We're talking about all the blood vessels. They also suffer. Why? For example, my grandmother, I spent a long time trying to convince my mom to give her testosterone as the therapy option. She wouldn't agree at all. My grandmother's heart is now just, kind of like a rag.
It's not even a heart anymore, it's just a diaphragm.
A diaphragm, it's hard.
To breathe, our main breathing muscle, how can you breathe deeply? If that's not enough, here's another easy test. Everyone can now do the breath holding test. If everything is not bad, then I should focus on my legs and order them. And we can easily hold our breath for a minute. Everyone who doesn't do this, of course, there's not enough testosterone.
So the guys watched the video, realized, yes, there really is a deficiency, but either they don't have the opportunity or they don't have the desire. Not everyone wants to get treatment and go to the doctor. They're afraid of the white coat. They don't trust them. They've had bad experiences and believe others just want their money, so they buy testosterone on their own. Well, either they bought it at a pharmacy and got it without a prescription, or they got it somewhere in a basement gym or from friends. On one hand, he's doing it for the right reasons. Let's say he guessed correctly. And it seems like he's doing everything by the book, so to speak, and he's feeling better. But there are people who don't get better and sometimes even get worse. What do you think about people prescribing testosterone for themselves? What are the pros, what are the cons, and what are the pitfalls? Those
who prescribe it for themselves. I would recommend prescribing only very mild medications like a gel, never anything injectable. Because self-medicating with injectable drugs can lead to cardiovascular and other problems. Why? Testosterone has a million functions in the body, but one of its very important functions is in surgery. By the way, this should be very useful for you. Testosterone stimulates erythropoiesis. So in elderly patients, it's impossible to cure anemia without normalizing testosterone. But also hypoxia, which may be caused by iron deficiency. It's now a pandemic. 10 years ago we kept saying vitamin D deficiency. We are 10 years late. Vitamin D deficiency led to a pandemic of iron deficiency, chronic hypoxia. Athletes do this when they go to the mountains. So that there is hypoxia.
So that erythropoietin is released.
So that very erythropoietin is released. And what does erythropoietin trigger? Hypoxic erythrocytosis. So if there is hypoxic erythrocytosis, a lot of erythrocytes, and you give testosterone, which destroys the US, so this erythrocytosis can lead to thrombosis. That's why those who self-medicate, what would I recommend? Get tested for erythropoietin if it's high. First, eliminate iron deficiency and omega deficiency, which also lead to chronic hypoxia, and only then consider testosterone.
Given identical test results, one doctor may prescribe one treatment, while another chooses a different one. Does this mean that only one of them is right? Or is it possible that even if their approaches are radically different, both can actually cure the patient? For some reason, our patients tend to categorize things. For example, you, Ilya, prescribed testosterone or some kind of gonadotropins or whatever. They approach someone saying, who told you to do this? Do it this way. Then add, but another doctor prescribed something else and it didn't work for me. I approach this like a chess game. There are many ways to move. What matters most is winning and its cost. And schools have different approaches. There isn't just one right way or only one correct method.
Every doctor has their own experience and protocols. How are we taught? Where do we get our experience from? We get our experience from our teachers, right?
I hope.
There. Well, we should.
Many. Unfortunately, there are a lot of self-taught people.
We should get our experience from teachers. Some people were taught by teachers there. If we're talking about injectables like sustanon, nandrolone, and so on, there's testosterone, propionate. Because teachers started back then, when Nebido didn't exist, right? Yeah. And they knew everything about sustanon and nandrolone, and when Nebido appeared, teachers didn't need it. because they already had the right one. See, someone studied but didn't learn about androgel there, so they'll never prescribe it. They don't know how. So it's about the teacher's experience. That's why, well, different schools, different approaches, different experiences, and I completely agree. Victory is important there.
The price is important?
Victory. Yes, well, there's more ahead. Some people like to observe the patient, so that the patient comes in every 2 weeks for monitoring. And patients differ too, right? And one doctor will prescribe medications that need to be injected more often, while someone else will prescribe a medication that needs to be injected less frequently.
The question is, my dear subscribers often ask, how do you choose a doctor then? I'm against going to someone without medical education, and I'll explain why you shouldn't. Consider how our department or any clinic operates. There are multiple supervision levels. For example, a patient is being treated. Inside the institution, there are protocols that must be followed for treatment. Here are the algorithms, and they are approved by the Ministry of Health. Well, we are in Russia, in the Russian Federation, so you have to treat according to the protocol. There is a law requiring you to follow things as written. The attending physician must comply, and as department head, I oversee this as the first level of control. And after each, let's say, discharge of a medical history, there is a special form that we fill out. We evaluate how the documentation is completed, whether everything is correct, and whether it was done in a timely manner. And there are several levels of control. Then there are special people who also check these forms to see if everything is correct. So this kind of control doesn't exist when a person is on their own, just floating freely, and they're sitting at home and playing, so there's no responsibility either. If you work poorly, you'll be punished legally. If you work poorly, you'll simply be fired, and people won't come to you. You know, this work into the void, this permissiveness, I'm against it. I'm not belittling those without medical education. Maybe they didn't have time or didn't want one. They claim it's too late, yet they keep learning, improving, and doing everything right. I truly have nothing against them.
Well, for now, still.
It happens, but there still needs to be control. But there are people who, in their ignorance is more dangerous than not knowing, because, well, if you just don't know, that's one thing. But when you're ignorant, you think you know. You talk about SHBG, about other things, and you spread it, and this spreading is pure harm. So how do you feel about guys who study, who try, basically, but don't have a medical education, and they're trying to do this? What's your attitude?
He can only do this for himself. That is, if you don't have a medical education, you try to help yourself, but you can't apply this knowledge to anyone else.
They set a good example. For instance, there's no one. I recently did a live stream with someone. Well, yes, he doesn't have a medical education, but the work he does overall is positive and good. He suggests taking contrast showers, doing sports, and similar activities.
It's kind of educational. I mean, it's not about hormone replacement therapy with prescription injectable drugs.
He doesn't go into endocrinology, but he works in other fields like rehabilitation and does good work. Overall, I have a positive attitude toward many guys involved in education. I think you'll agree there are sincere people who do this to benefit others.
Yes, when it comes to over-the-counter medications, they can give advice, but when it comes to prescription drugs, there are still a lot of nuances. Like, for example, how to inject testosterone, where to inject it. And you can get a fat embolism.
Yes, in the leg, especially when they inject it.
That's why all oil-based solutions should only be injected in a clinic. Do you agree? Yes, you can get it. We see this about every 6 months. Thank you. We have patients with such abscesses that later require hospitalization and incision because of improper injection.
There are some pressing questions about hormone replacement therapy, and their answers will probably address many fears. First, blood thickening on hormone replacement therapy. How can it be prevented? And if sludging happens, is erythrocytophoresis the solution? Some prescribe chemo drugs. Can you believe it? No.
Under no circumstances. Thickening of the blood, that's what we were talking about. Why does blood thickening happen? This thickening of the blood needs to be called by its proper medical name. It's erythrocytosis. So it's an overdose. It's an overdose, and once again overdose. That's it. You need to either reduce the frequency of injections or decrease the dose. And by the way, one of the drugs that's very popular in Russia is prescribed in a volume of 4 milliliters, 1000 milligrams. But in America, they didn't approve such a dosage. And they have 3 milliliters and 850 milligrams I.
To be honest, sometimes I split it in half.
You see, and again, this is...
I'm not injecting myself. I'm not injecting myself. I'm not on GZT, I'm doing fine.
See, this is already my own experience. Did you notice that too? And I really love, for example, couples 45 plus. I recommend 3 milliliters for the boy and 1 milliliter for the girl.
Share it with your wife. If it happens, we reduce the dose or take a break. What do you think about bloodletting?
It's the same thing.
A vicious circle?
They drain the blood, a vicious circle. Of course not, but the most effective, the most efficient thing is that no one will have any thrombosis when the blood thickens. If the erythrocyte membrane is elastic, the erythrocyte should be like a gymnast, as I like to say. It should be flexible. Therefore, the higher the hematocrit, the higher the omega-3 index should be. It should be 16% or higher. And then you don't have to be afraid of any kind of erythrocytosis. And also drink more, drink.
Bad lipid profile on hormone replacement therapy. Why does this happen and what should you do about it?
Again, you need to figure it out here. Which lipid profile? Unfortunately, very often a bad lipid profile is simply understood as elevated total cholesterol, which is actually not informative at all.
Suppose we did a lipoprotein test, checked cholesterol, and reviewed the atherogenic index ratio. Would you support that? How is it usually divided now? Either they don't do anything, or they just take omega supplements and, for example, add something like cardiomagnil, or they use statins in small doses.
No, well, we are against statins. And can you
explain to the guys why high doses of statins can be harmful?
Statins are harmful at any dose, because what exactly do they do? Statins lower cholesterol. Editor cholesterol is the raw material, the substrate for the synthesis of absolutely all steroid hormones. And
cell membranes as well.
Testosterone, vitamin D, estrogens, progesterone, dehydroepiandrosterone, cortisol, all of them. That's why we use statins. You always have to find the cause. Honestly, I've never seen it myself. To have a perfect lipid profile, they prescribed a medication, testosterone, estrogens, progesterone, any kind of hormone replacement therapy, and ended up with a bad lipid profile. Usually there are 3 main causes behind dyslipidemia. The most common cause is vitamin D deficiency. The second most common is a deficiency of omega-3 polyunsaturated fatty acids. And the third is hypothyroidism. You must always identify and fix the cause.
The dosage of testosterone in hormone replacement therapy. I usually tell my patients there are 3 key points: medication type, dosage, and frequency. So all of this is individual for each person. One person may need one dosage, another needs a different one. Some people metabolize it faster. Well, so this is of course individual. Tell me, but there is such an effect as addiction. It seems like we shouldn't have it with medications. But there are simple examples. Take nasal drops, for example. They work all day at first, then their effect decreases. Chemotherapy and its effect on cancer cells. At first, there is a good effect for 2 or 3 courses. Then suddenly it starts to progress. Prostate cancer cells at first can't grow without testosterone. Then they mutate and start to grow, even with testosterone. Some people say, I was always on a certain dose, and then suddenly I realized it wasn't enough for me anymore. That's psychological. Or is there still some kind of dependency dose that over the years you need to increase it? Yes or no? I'm interested in your opinion. And secondly, how can you avoid side effects when increasing the dose? Yes, that's the first question. And secondly, well, let's start with the first one so we don't get confused. So, is there addiction?
No, of course, there is no addiction at all. It's just that when a person starts, meaning before testosterone and after testosterone, it's like, wow.
The effect disappears. That's it.
Yes, it's like these are completely different lives. And here, when we get sick with the flu or something else, I don't know, and then we recover, everything feels so great, it's so easy to breathe, we feel uplifted, but then we just get used to it. It's just not like that anymore. I mean, that's the effect. And regarding the question about improvement, usually it's the opposite. What happens? For young people whose obesity was caused by a deficiency of vitamin D, omega, iron, or thyroid hormones, or iodine, obesity led to a decrease in testosterone, so we give testosterone, and as the obesity goes away, we actually reduce the dose. Because the less fat there is, the more your own testosterone is secreted.
You know what the question is? So there's hormone replacement therapy, and then there are people who, through their lifestyle or by taking antiestrogens, and then there's something in between. Zhenya and I both call it physiological correction. When he has, say, 12, 15 units, but that's not enough, we add a packet of androgel and maintain it. Yes.
So, who might not have enough of their own 12 15, 20, 30, 40, 50, and so on? Those who have a genetic decrease in receptor sensitivity. Well, maybe here I would even, actually you need to. It's mostly for sex anyway, testosterone for young people, right?
Usually that's what motivates them most to come. They come less when they get up at night.
Well, sex, of course, but I would recommend just finding a partner with the same receptor. It's important for the receptors to match in sex so that a strong sexual constitution is truly strong. So, as a rule, men with a weak or normal constitution, when they choose a woman with a strong one, they try to match her.
Well, people often ask about the duration of intercourse too. Is it too little? Is it too much? I always say it should satisfy both you and your partner, including the frequency. Sometimes people come and say they have a problem with sex. I ask, what kind of problem? The first time is fine, but the second doesn't work, and the third is very difficult. So I think the third time is really something. So these are likely conditioned, not objective needs.
Unfortunately, today, there is no science of sex in Russia. It's been destroyed, yes. That is sexopathology. There should be sexology, the science of what's normal. But what is normal there? Today people are learning about sex. Where?
They learn from friends in porn movies.
We know ourselves how the actors achieve that.
Many of them are on injections. Yes.
Of course. Well, how else in front of the camera? Can you do it on camera? No.
Have you tried?
Well, for the camera, you'll obviously need what? Well,
it's obviously harder. Many can't even pee with someone watching, so having sex must be tough.
Of course, with injections. That's why you shouldn't try to learn from or imitate those who can do it on camera.
Do girls appear more frequently on hormone replacement therapy? If he's injecting his gonads, is he on hormone replacement therapy? Athletes on cycles do that a lot. Oddly, girls seem to do it more. I've also seen publications saying it's usually girls. In your practice, is it?
Have you noticed? I didn't quite understand girls.
Are they being born?
Girls are born more often. So, well, look. So, a girl is a sperm carrying an X.
Chromosome. He
is heavier, yes, so he runs slower, but he lives longer. So, in order to have a girl, you need to stop. Sexual intercourse happened less often. Yes.
So that they would wait, so that he would...
Yes, so they'd wait and...
So, you have sex 2 to 3 days before a girl's ovulation? Yes. So if...
Ovulation, if it's ovulation, then it will reach. If the egg is already there, then it will reach. Who will reach? The boy? He is faster?
This is very, very important because there are families. I even have relatives who have 5, 6, 7 girls. Everyone is trying ovulation. Want a girl? Have sex before ovulation. Want a boy? Have sex during...
Ovulation, yes, ovulation.
Here's that kind of advice. They say that, they say, it's just me, asking, maybe I look a bit silly sometimes, but I ask because I'm curious. What happens if someone has low testosterone during puberty when sexual characteristics develop? And then if we discover this at 25 or 30 years old and compensate for it, his penis won't be the way it should be, and his character won't be the way it should have been. During development, normal testosterone levels are crucial. Why am I mentioning this? Puberty doesn't occur at 18, 20, or 25. When we're responsible for ourselves and when we're still little and when we don't know this ourselves, we don't have the knowledge. It's important for parents to notice if a child is overweight or still has no body hair at 17. Children need to be checked. How can you tell if a child might have a testosterone deficiency and at what age? People often approach me, though I don't treat children. They say, he's 14, has a small penis, no pubic hair, and is overweight. When should I check them, and how do I know if my child has low testosterone?
Again, it's visible, it's noticeable, and you can hear it. We have several periods. We talked about the 40 to 60 period, which is the most difficult, the most challenging period of transitioning from youth. The mind is still there. Testosterone deficiency in children can be complex. It could be due to the hospital, testosterone levels, or other factors. Ages 0 to 25 are crucial, as childhood ends at 25. 25 to 45 is the best age. You really need to enjoy everything at 25. By the way, I don't agree with the healthy lifestyle enthusiasts. From 25 to 45, you don't need to follow a healthy lifestyle. If everything is fine, testosterone forgives everything. You can get less sleep, you can overeat, you can drink too much. Everything is forgiven. Testosterone forgives everything from 25 to 45. Enjoy sex too. But before 25, that's the most responsible age. And of course, the responsibility lies with whom? With the parents. And the parents' task is to bring their child to 25 healthy with normal testosterone. And so, in the age range of 0 to 25, there are two periods, 0 to 14. It's called the snotty childhood. This is
Pre-puberty, basically.
Yes, from 0 to 14. Why is it called the snotty childhood? Because there isn't any testosterone, estrogen, or progesterone. Kids get sick, but at 14 puberty begins, which kind of ends around 25. And that's when, if we're talking about testosterone at 14, it should start to appear. Ambitions should start to appear. Absolutely.
That's when your character declines.
Yes, boys have to do something abruptly painfully, but if their testosterone levels are fine, the boy does it himself. Because, a mom will never do it, the boy himself has to take it and just snip, snip, snip. To cut the umbilical cord, I remember how my child did it. Oh, it was so scary and painful. One day, when he was 14, the nanny picked him up from school. I'm sitting at the academic council, my student is defending her thesis, and here I am. The nanny calls and says, Sasha won't go home with me. I ask, what do you mean won't? How can he go alone? How will he cross the road? There's Leningradskoye highway there. So I say, let him call me, let him. I say, Sasha, I'm begging you, please, I'll come home and we'll sort it out. No, he said, that's it. He cut me off. See, testosterone is about actions. Yes, it's about courage. It's about taking responsibility for those things yourself. A girl should appear in a boy's life. He absolutely must fall in love and he needs to become the best at something. And if a boy doesn't become the best at something, tennis, I don't know, physics, math, chemistry, biology. Collecting, like I have the most expensive stamp. He becomes the first hooligan. And if you don't see this, of course, don't go. Run. You have to run. And what should you do? Check the volume of the testicle. And at 14 years old, it should already be at least 4 milliliters. If it's less than 4 milliliters, it means something is going on for some reason. At best, it's a delay in puberty. Again, it's the same DI and thyroid hormones. There can be social stress, lack of sleep, or in the worst case, 1 in 600 newborn boys has congenital hypogonadism, Klinefelter syndrome, 46XXY. Why? By the way, I actually want to take a look at it right now. They say that a law has been passed that there will be screening at birth for 30...
Karyotypes, look.
Well, I don't know. Klinefelter for 30 congenital diseases. Before there were 5, now there will be 30. And I'm curious, did they include Klinefelter?
Well, Kalman should theoretically be included too.
Kalman is rare. Generally, you should. It's 1 in 600, but not a single disease. Thank God there's a screening for VDKM. Well, that's 1 in 10 or 20,000, but here, all these boys can be helped. If at 14 to the question.
Not to miss it, because if you do...
From the age of 14 they should be. No, from the age of 14 they should be on hormone replacement therapy.
I mean, if you miss it, it won't develop the way it should have. He'll have wide hips, narrow shoulders, a small penis. And later, you can't reverse that at 30 when it will be difficult.
By the way, proportion is another thing. How you can suspect it, the proportion and the taller. For a girl too, they're just beautiful. Unfortunately, they're not suitable for sex. The longer the legs, the worse the testosterone receptor works.
Everyone watches the video, stretches their legs, looks at themselves, then at their wife. Standards. We're all about testosterone, testosterone. 2 days ago, someone sent me a story by a doctor written by a media figure, mentioning some American associations and related topics. I see what he's writing. It's just more nonsense. What we said about testosterone was already nonsense. I saw it in his story, nonsense. He talks about ferritin. If someone tells you that ferritin shouldn't be like it says in the normal ranges, but should be higher, that it supposedly depends on your weight. This is a doctor, supposedly a specialist in quotes, basically showing that he's different from the others. I very often see girls with low ferritin. Gynecologists say it's within the reference range, but she has a ferritin of 20, while many charts start at 22. For some reason, my hair is falling out again.
We're talking about that very reference range.
So, what is the ferritin reference range?
No one knows the normal range for ferritin yet. So at some point, well, now everyone is familiar with thyroid stimulating hormone, right? But there was a time when the normal thyroid stimulating hormone was 10, then 8, then 6, and so on. Teaching methods vary between schools and instructors.
Some claim 2.5 and people agree.
In some schools they teach 5, in some schools they teach 4. In our school,
2.5,
we teach 2.5, and the lower it is, and again, of course, clinic again. When we started working on this 5 years ago, we were the first to raise this topic. Why are we always the first everywhere? Because at one time I thought that testosterone could cure everyone. And so I kept prescribing testosterone, obesity, testosterone. There was already so much testosterone. Libido and erections were great, but the obesity wouldn't go away. Editor, we started investigating why it persisted. And so we dug deeper and found vitamin D, and testosterone. Again, someone still can't lose weight. So we found omega D, omega testosterone, everything seems fine, but still the weight doesn't go away. And 5 years ago we realized that it's some kind of hypoxia. Cellulite, yes, cellulite is always like that.
It could be hypoxia.
Always hypoxia. So they started digging, they got to ferritin, and when we started working with ferritin, continuing on, all the labs used to give the lower reference limit for ferritin as 5 now. There are no such labs anymore. Now it's usually 10-20, but 5 years ago it was 5. Trust me, time will pass. And I'm sure that the lower limit won't be weight plus age, right? Right?
Yeah. I'm sure that the lower limit will be 200 to 250. Well, because iron is such an important, such a key, yes, fundamental micronutrient for health, but such a key Micronutrient can't have such a wide range like 20-400. There's more.
The more important some indicator is,
More precise,
the less,
the gap range.
the smallest gap range. Do you know what has it?
What has it? Well, probably our glucose.
There it's even more, 3355. And the smallest one actually is blood pH.
That's right, it is.
7.35, 7.45. Well,
Hear about ferritin. Many people say, like you mentioned, weight and age. And some also say to add 70. Like some people use weight plus 50 or weight plus 70, but that's very far from 20. What would you say, what advice would you give to doctors who give such foolish advice, being endocrinologists, by the way, from Sechenov Institute, for example, who write on social media and spread their ignorance to a large audience? Yes, they should come to you to learn.
absolutely. Absolutely. Because today this is our only department. The only department that teaches this. We'll start with the fact that, as I say, you can't separate testosterone from estrogens. Why saliva? What will you always see in saliva? For example, high testosterone, subtitles dimatorzok, and low estrogens. That's why. After all, estrogens, as we said, are synthesized from testosterone. If we see a lot of testosterone and little estrogen, we start to understand that aromatase isn't working well. And why isn't it working well?
Maybe it's iron dependent.
Because it's iron dependent, of course. What else do we see in the steroid profile of saliva? High pregnenolone, a hormone that does not have an independent function, but it is a precursor hormone. That is, pregnenolone comes from cholesterol, and then everything else comes from pregnenolone. We see high pregnenolone but low. The hormone of altruism, DIGA, which should never be given to anyone, because no external DIGA will make you an altruist. It must be synthesized independently, showing the raw material exists, but what's derived from it is insufficient. Because all enzymes, really, absolutely, all enzymes, all cytochromes, they are all iron dependent. That's why you should aim for your ferritin to be at the upper limit of normal, especially if there is obesity, which is actually inflammation. You need to divide that ferritin by 2. So you need to see what should be checked along with ferritin. The transference saturation index, and it should be saturated with iron. Well, at 50%.
Now, it's popular to check soluble transferrin receptors sometimes.
We started, that's everything that comes up.
They say it doesn't increase as often due to inflammation, unlike ferritin.
It doesn't match up. So normal receptors do not rule out receptors of latent iron deficiency. You see, what is everyone waiting for?
Anemia? Everyone is waiting for anemia, but there might not be any.
Well, that's just it.
It's embarrassing. In the course, this hemoglobin is jelly, not blood, and lacks iron.
It's embarrassing in the 21st century to wait until you have anemia. Being obese is just as embarrassing. Well, I don't know what...
That's the third stage of iron deficiency.
Diabetes mellitus, well, also type 2.
First, there may be insulin resistance, which can lead to diabetes. I agree. I just wanted a high-level specialist like you to say it out loud. Because the more people say the right things, the fewer gaps we leave for people who, I hope, are mistaken, sincerely mistaken, I hope, to think otherwise. Why? People who have been in the profession longer than them, who have clinical experience dozens of times greater than theirs, say things that are different from what they are spreading. That's
Hype? That's it, to get some hype?
You know,
I think that after our show, you know how much hype there will be?
I'm not watching anything. Who's filming here again? But I believe that we live in a state governed by law, and to all sorts of privacy violations should be handled legally. Impose financial penalties or sanctions on them.
Well, I know. Maybe, but I think we shouldn't do it. You know, when I wanted to do it 3 times so that the ideas, what we are sharing with you now, would be heard there. For that, I needed a certain status there. Yes, that's right. And when I wanted that status there 3 times, so that louder, what kind of country is this? Sadly, that's true.
A large machine and papers on the wall.
No, the teacher was brilliant. Gennady Ilyich Kozlov taught me. Do you know what he taught me? Sveta always told me, there are titles, yes, but there is also knowledge. Strive for knowledge, not for titles. That's what you should do. But unfortunately, in Russia, knowledge and titles often don't match.
Sometimes it's the opposite. A doctor with many titles, knowledge, and certificates still knows nothing. Sometimes the blogger we criticize among the educated actually knows more.
That's what I'm talking about. Unfortunately for now, it's still somehow about the titles. And when you asked how to introduce me, I said, yes, I don't care how you introduce me, because I never aimed for all those titles. They just came on their own later. But when I needed some kind of status, and just so I wouldn't get it, about the hype, can you imagine? They called me uneducated.
Well, they can say that about me, that I bought my diploma, yes.
I'm a person without education. They said I studied with some sailor. This is my brilliant professor, Gennady Ilyich Kozlov, and he was a very respected person. And about the question of struggle, I also thought, here I am now. We live in a state governed by law. This is serious. This is an article.
Yes, you can get up to 2 years.
And I wanted to as well. Besides, it was how many witnesses were there. There you go. A wise person once told me, Svet, answer 3 times. To the question, why do you need to go to court there? I said, well, so that everyone knows that this person, well, you can't do that. He says, and what do you think that someone doesn't know? Of those who were present there, yes, they all know this. Second, why? Do you want money from him? I said, no, I don't want money. Is there a third reason? That's all. I realized that you need to spend your energy on creation, on doing good. You shouldn't waste your energy on fighting. You shouldn't waste your energy on war, because in any fight or war, of course, both sides lose. That's right. You should spend your energy on creation. Spend your energy on enlightenment. I asked you, why are you doing this?
Podcasts are my thing, and I have no ads, just my own successful projects. I do this for enlightenment and benefit. I had something inside. I likely had an issue in September and started in October. I couldn't decide for a year and lacked time. When I finished my doctoral thesis, I finally made up my mind. And then I started missing the feeling that I was doing something that reached the masses. I started missing my work. I did targeted work, performing surgery in different places. Yes, that's about 1,500 people a year at my main job. Yes, that's about 1,500 to 2,000 people consulted per year. But that wasn't enough for me anymore. I always liked teaching, enlightening, doing it sincerely because...
There are 3 professions from God. No, there's a 4th one. It's healing. What we are doing with you is teaching. That's also what we're doing together right now. And the hardest thing, I probably could never do that. It's judging. So let's not do that.
Judge those people.
Hey,
That's why I never do it, no matter what anyone records about me.
why do they do that? Do they lack education, or do they have some kind of benefit?
They are sincerely mistaken, Svetlana Yurievna, sincerely mistaken. Time will pass, it will teach them, that's how it will be.
On their conscience, that's right?
You have to earn your health. For that, you need to work on yourself, you need to eat right, you need to do sports, you need to integrate your life. You know what made me really happy? I didn't show the questions in advance and I didn't prepare them specifically for you. I honestly didn't think you would come. And your opinion, your answer that I got to each question, first of all, is important and valuable to me in itself. And I really like that there wasn't a moment when I disagreed with something. And I often finish after you. It's really nice that we have this school of understanding that our concepts are the same. It's really cool. Basically, we've covered the main questions with you. Once again, a big heartfelt thank you. I guess we'd like you to give some advice to men and women. How can they take care of themselves? And I'd like to get some motivational message from you as well.
Taking care of yourself actually means taking care of your testosterone. That is, until age 45. minimize, of course, as much as possible, all kinds of stress. And what kinds of stress do we have? They can be social. What are social stresses? Is it people? Nothing harms our testosterone as much as toxic, unpleasant people. We have to interact with them. So there should be hygiene in communication. Before 45, protect yourself. After 45, find your own guide into this amazing world. Testosterone is the hormone of fearlessness and shamelessness. That's what I now call it. The hormone of fearlessness and shamelessness. So if something feels scary or shameful, you should come earlier. Maybe that's the very receptor, right? In general, get to know yourself, get to know your testosterone, love it, and life will be very interesting.
Thank you. Behind me is the Infinity Gauntlet with the Infinity Stones. In the movie, you could snap your fingers and do anything. I really hope that today's podcast with your participation will be like a snap. And all the uneducated people, all the people who are mistaken, well, they won't disappear, but I hope they'll get smarter. Well,
for that, again, you need testosterone, which will turn into estrogens under the influence of iron, and only then do you need it. That's the harmony of hormones.
We'll keep working and filming strength and
mind, the king of hormones and the queen of hormones.
Thank you very much, Svetlana Yurievna.